Good afternoon. This is the special coverage of the coronavirus crisis using the combined forces of TV5 and Cignal TV's One News, Radio 5, and 1PH. The European Union has moved to close Europe's external borders for 30 days in a bid to curb the further spread of COVID-19. EU leaders, however, established fast-track lanes at their country's frontiers to keep goods moving. This comes after Italy tallied 345 more deaths from the deadly virus.
To limit the spread of the virus globally, we agreed to reinforce our external borders by applying a coordinated temporary restriction of non-essential travel to the EU for a period of 30 days, based on the approach proposed by the Commission.
The Philippine National Police Highway Patrol Group, or HPG, continues to clamp down on public utility vehicles, or PUVs, that still ply the roads despite the suspension of public transportation. To give us more details on the crackdown, we have News 5 correspondent Pat Mangunil live from Campo Crame in Quezon City. Pat.
Ed, pinagpatuloy nga ng Highway Patrol Group ang pagpatrolya kontra sa mga public utility vehicles na patuloy pa ring namamasada sa kabila ng enhanced community quarantine sa buong Luzon. Kung kahapon, naging babala lang muna ang paghuli at pagpapalaya rin sa mga taxi, ngayon handa na ang PNP-HPG na mag-issue ng ticket at mag-impound. Sinuyod ng mga HPG riders ang kahabaan ng EDSA kasama ang media mula southbound sa Pasay hanggang northbound sa Monumento. Malinis, maluwag at wala ng mga PUV, maliban na lang sa mga pasaway na tricycle at pedicab na naabutang tumatawid at bumabaybay pa rin sa EDSA. Pati mga tricycle ng barangay na nakita sa EDSA, hindi pinalampas. Yan ay kahit pa sabihing emergency at magpapahatid lang daw sa ospital, pero walang maipakitang katibayan. Isa ring taxi ang pinara na may sakay pang pasahero. Agad kinumpiska ang kanilang mga lisensya at pina-impound ang mga sasakyan. Ang kanilang ticket ay para sa paglabag sa Proclamation 429 o ang Enhanced Community Quarantine at ang tricycle ban sa National Highway. Huminto rin ang HPG sa Balintawak Public Market para ipaalala sa mga mamimili at nagtitinda na panatilihin ang social distancing na tila nakakaligtaan na. Maliban naman sa EDSA ay nakatakda rin ang HPG na magbantay sa iba pang highway gaya ng C5, Marcos Highway, Commonwealth Avenue, Quezon Avenue, Ortigas Avenue at Taft-Baclaran area. Ed, may direktiba pa rin ang HPG sa kanilang mga regional highway patrol units sa iba pang bahagi ng Luzon na magsagawa ng kaparehong operasyon laban sa mga PUV sa loob ng quarantine period. Ed?
Okay, Pat, siguro para klaro lang, no, yung suspension ng lahat ng public transportation, hindi lang yan sa Metro Manila, kundi sa kabuuan ng Luzon. So, bagamat nakita natin HPG lamang, pero that I suppose is being replicated all over mainland Luzon.
Oo, tama yan, Bok. Kaya nga yung HPG, pati ang kanilang regional units, talagang magsasagawa na rin ng operasyon sa laban sa mga PUV na hindi pa rin sumusunod dito sa quarantine na bawal na ngang mamasada. Ed?
Pero malaking pinagkaiba niyan doon sa kahapon. Kasi kahapon doon sa EDSA, ang daming nahuling mga taxi. Ngayon, doon sa video mo at least, isa lamang yung nahuling taxi tsaka isang tricycle.
Actually, Ed, oo, isang taxi na lamang ang nakita, malinis na, wala ng bus, wala ng ibang jeep, wala ng iba pang mga taxi. Yung mga tricycle ang pasaway, siguro higit kumulang mga less than 10 ang nasita nila at natiketan at na-impound. Pati pedicab kasama na rin yan, Ed.
Although I'm wondering lang, dun sa violation nila sa ticket, may nakalagay sa ticket nila na violation of the quarantine? Or is that a special, is that a special violation?
Oo, yun nga, tinanong din natin yan sa mga HPG. Deputized naman sila mag-ticket ng mga LTO violations. Pero inilagay na lang nila o nakakwalify doon sa parting others itong violation ng mga drivers at mga taxi, tricycle.
Okay.
Ed.
Bok, tapos nabanggit mo pati yung barangay tricycle, which I suppose naman ay hindi pampasada, hinuli. I was wondering about that kasi you would think na yung barangay vehicle would be allowed to operate provided that it's for essential use only. Pero hindi naman pampasada siguro yung barangay tricycle.
Oo, initially, Ed, ang sinabi kasi ng PNP-HPG, hindi exempted kung kahit ikaw ay tricycle patrol na ginagamit ng barangay. As long as tumawid ka sa EDSA, prohibited naman talaga ang mga tricycle at pedicab sa EDSA, ay mahuhuli pa rin, Ed.
Okay. Bok, tapos sa pag-iikot niyo sa Metro Manila, I suppose kasi nag-ikot kayo with the HPG. Sa pag-iikot niyo sa Metro Manila, how does the volume of people and traffic compare to yesterday?
Compared to yesterday, Ed, wala na halos tao, pa isa-isa na lang. May mga nagkaroon lang nakita tayo ng bulto ng mga tao sa Balintawak Public Market. Kaya huminto doon ang HPG kanina para sitahin din sila, paalalahanan. Kasi nakakalimutan na rin yung social distancing. Katunayan, dikit-dikit sila na namamalengke, nag-iintay ng mga paninda o naghahanap ng paninda doon, Ed. Pero mas maluwag na, wala nang gaanong taxi talaga. Yung mga terminal ng jeep at tricycle na nakita natin, hindi na bumabiyahe, hindi na pumapasada. Nakatenga lang doon sa kanilang terminals. Ed?
Okay, Pat, yung sinita doon sa Balintawak Market, yung mga magkakalapit, hindi naman yung mismong palengke, no? Because I understand that yung market is one of those exempted from the ban on operations.
Oo, Ed. Ang sinita lang binigyan lang ng paalala gamit ang megaphone actually. Ang mga HPG nag-announce na panatilihin ang 1 meter distance sa isa't isa habang namamalengke. Hindi naman sila prohibited na bumili doon. Sinabihan lang sila na keep your distance from each other. Ed?
Although, Pat, one more question. I'm not really sure if you have the answer to this. Pero kung ikaw nga naman, pupunta ka sa palengke para bumili, at wala kang kotse, and I suppose that applies to a lot of Filipinos in Metro Manila na walang kotse, paano ka pupunta ng palengke? At paano ka babalik? I'm wondering lang if you've noticed how that works. Diba? If you have to buy food, how do you move around?
Oo. Ed, ang napansin lang natin, yung iba, kung meron silang private na sasakyan, yun makikisabay. Ang iba naman, kung may makikiangkas sa motor ng isang kakilala, maaari naman. Kung hindi, at kung malapit lang, tsatsagain mo talagang lakarin ang papupuntahan mo kung saan ka mamimili ng pagkain. Ed?
Okay, Patricia Mangune reporting to us live from Campo Crame in Quezon City. Pat, thank you. Now, in one of our newscasts just an hour ago, the medical city in Pasig revealed that out of 23 COVID-positive patients under their care, some were already sent home to undergo self-quarantine as they only experience mild symptoms. Dr. Carl Henson, the head of the epidemic response team of the medical city Pasig, said that some of the patients who tested positive for the virus were transferred to other medical institutions. He also added that there are currently only 16 COVID-19 positive cases admitted in their hospital, 2 of whom are under intensive care unit, while 14 are in their regular units. He also says that there are patients under investigation in their care, 8 of whom are in the ICU, while 41 are in their regular units.
For patients na with very mild symptoms, bata, walang masyadong medical problems, tapos mild ang symptoms, they can actually stay home for quarantine. Hindi po lahat ina-admit sa ospital.
And now to help us understand the possible repercussions of these moves, Dr. Troy Hepte, a former consultant to the Health Department, actually he's now a consultant as well to government and as far as the COVID-19 response is concerned, and of course to the World Health Organization, is now joining us on the line. Dr. Hepte, thank you for joining us again.
Ed, nice to be with you again. Good afternoon.
Hi, sir. Sir, iklarin lang namin po kasi we were talking earlier with Dr. Carl Henson, ERT head po ng Medical City, and he was telling us na yung bagong instructions ng Department of Health to all hospitals is kung mildly symptomatic lamang at stable naman yung pasyente, even if they're positive with COVID-19, excuse me, they can be sent home for home quarantine. First of all, we'd like to know if you've heard about this, and secondly, what are the possible repercussions of this decision?
Salamat, Ed. Bale, paglilinaw natin na doon sa ginagawa ng DH, ang ginagawa niya, ino-observe niya kasi kung ano yung condition sa ating healthcare system.
Opo.
Such that tinitingnan natin kung paano natin pa-prioritize ngayon yung ating mga hospital beds, yung ating isolation areas, our ICU beds, for those who truly need it.
Yes, sir.
With what we know about COVID-19 is that 80%, around 80 or 81% of all cases na naging confirmed or positive are actually mild na
Yes, sir.
cases, which necessitates just supportive treatment, observation, and if ever may mangyari sa kanila, we would parang advise that they go back to the hospital to seek more medical care or further medical care. Doon naman sa mga nasa around 20% with severe symptoms, ito yung mga binabantayan natin kung meron silang either severe na illness or meron silang comorbidities or elderly sila. We advise testing first of all, and then if needed, we would necessitate na kailangan sila daling sa mga holding or isolation areas for observation. And if talagang critical sila, these are admitted din sa ICUs natin. Yung ICUs natin pala, very limited kasi all over the country. I think there was an estimate of around 1,000 or maybe less pa, which are yung mga functional beds natin sa ICU. So we need to prioritize those who we think would have complications or those who might have a severe outcome na baka maging mortality. So what we see is that yung mga nakakasakit at namamatay, ito yung mga elderly, ito yung mga may chronic diseases. So that's why we are advising na yung mga mild na cases or those with symptoms that haven't been tested might as well have itong quarantine, social distancing, and if possible, if they are positive, sana magkaroon na silang special arrangements where they can be isolated. They can work with the barangay or with their local government units dun sa mga identified quarantine stations within their barangays, Ed.
Doctor, I just need to clarify something. Considering kasi that you are in close coordination and you're being consulted by the government with regard to how to handle the COVID-19 issue, is it true? I mean, is it accurate to say na even those who are COVID positive, so long as they are only mildly symptomatic, that they are or are being sent home already for home quarantine to give way to those who may be experiencing greater distress? Is that accurate?
Yeah, right now, if I were to advise the government and our public health officials, it would be actually, the way you said it, it's a way to prioritize what our healthcare system should be taking care of. Yung mga pinaka-marginalized, ito yung mga elderly and yung mga may comorbidities. And I think this is a good way to come up with a priority setting mechanism. It's actually technically called a triage, where
Yes, sir.
we try to categorize patients as per
Yes, sir.
any kind of outcome or
Doctor, sir, I'm sorry, we're losing you. Are you still there?
Oh, sorry, yeah.
Yes, sir.
Can you hear me, Ed?
Yes, sir, doctor. Yes, sir. So it's confirmed that this is already a decision by the health department. Is this already a policy decision that for the milder cases where they exhibit mild symptoms only, even though they're COVID positive, they can be sent home or they should be sent home for home quarantine?
Yeah. What's very clear in the revised protocol for the guidelines for COVID-19 is that if you have symptoms, if you have a cough, cold, sneezing, or if you have a sore throat, you might as well be comfortable and stay at home so where you can recuperate. This will take some time as you eventually recover, but what we are saying also is that we need to have the severe patients, those with chronic diseases in our hospitals. So this is a way to make people be aware that we need to have them more responsible as to how they should take care of themselves at home. So those na hindi na kailangang i-test, ito yung mga mild symptoms lang. Remember that we also have a limited number of test kits.
Yes, sir.
So
Yes, sir.
we need to prioritize that also. Yung sa diagnosis pa lang, we also need to remind our doctors, our hospitals that if they have mild symptoms, they are actually not a priority for testing unless there are extenuating circumstances. na maganda na magpa-test sila if kunwari alanganin kung they are having any respiratory distress or nahihirapan sila with their own symptoms. It's still a gray area where the doctor has to come in, come up with a good judgment as to how to manage that patient.
Yes, sir.
But generally, for mild cases, we just advise them not to go to our hospitals right now kasi they're so limited dun sa ability natin to accommodate yung gusto magpa-test, and also dun sa problem kung sila ay mild, kung dun sila sa hospital, baka ano pa sila magkasakit siguro kung makahawa pa sila ng ibang sakit dun sa hospital.
Yes, sir. Well, doctor, I'm sure everybody understands completely the need to manage the prioritization of those who are sick or who may be showing symptoms. Pero doctor, what I mean is that if somebody is known already to be COVID positive, pero very mild lang yung symptoms niya, would they be sent home for home quarantine, even if they're positive already, tested positive, pero mild yung symptoms, and they're young and they're stable and they're pretty healthy, aside from the fact that they have COVID-19, should they be sent home for home quarantine to give way for others?
Salamat, Ed, for clarifying. I think the DOH is very clear dun sa before the testing part, bale yung if mild lang symptoms mo and you are not tested pa, you can just very well stay at home, tapos you can try to manage yung mga symptoms as they come. Parang trangkaso lang siya, nawawala rin siya eventually, and we just need supportive treatment. The gray area now is when the doctor is diagnosing the patient, tapos kung nag-positive siya, at least may, I think, observation period pa yata eh. It's not a clear-cut protocol pa. As for what you mentioned, kung positive pa siya, are they supposed to be sent home kung mild lang? It's supposed to be the doctor's decision or judgment kung kailangan pa uwiin sila. And if it just so happens na mukhang very mild siya, it's also the call of the doctor medically based on his diagnosis kung ano yung pwedeng ma-advise niya. They can't stay definitely in the hospital so there's no other way but for them to be advised to go home. But if some patients kasi will be presenting na medyo nasa gray area na baka they might have symptoms that mukhang nagpo-progress. That's why we need to observe them. We want to monitor them. And if need be, we have to admit them. And worst case scenario is that they end up in the ICU so that they will be closely observed.
So yung gray area po na yan will be up to the good judgment lang of the hospital and the doctor.
Yes. So we have to emphasize that we need the good clinical skills of the doctors, the healthcare workers, to look at the patient's condition. And then if they have mild, a case of mild COVID-19, they will be advised for isolation sa bahay or in the quarantine areas identified by the local government. So they need to be separated. And it's just the difference between knowing that you're positive and having symptoms and you're likely to have COVID-19. So since we know that there are a lot of cases na ngayon na undocumented, might as well try to come up with those steps in the local government unit. So we have to, yung setting kasi sa bahay minsan, it's unlikely na yun sa space, baka hindi nila ma-accommodate. The LGU can step in to tell people where they can go. So they will identify areas where they can have those quarantine parang facilities.
So, Doctor, with that in mind, now more than ever, people have to be very conscious of quarantine, of social distancing, and all these other measures that we are putting into effect.
Yes. Dapat talaga mapaigting natin yung ating mga ginagawang measures ngayon. It will take at least 2 weeks, Ed, for us to have parang an observation na kung magpa-plateau or bababa yung number of cases natin. But in the coming 2 weeks, pataas pa to ng pataas siguro. Kasi din sa nakita natin from the other countries, the doubling of the number of cases occurs like parang every 5 or 6 days. So it will be about 2 weeks na pataas pa yung number of cases natin.
Okay, Dr. Troy Hepte, the foremost epidemiologist in the country, thank you for joining us and we hope to talk to you again. Maraming salamat po, Doctor.
Thank you.
That's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, The Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.